Hello, everyone. This is Dr. Priyanka Mehta, women's health expert from Chennai, in conversation with Dr. Balu, who is an emotional wellness coach and a psychiatrist from London. So, in continuation with our previous video about parents and puberty, where we were talking about why should parents talk to their kids about puberty. Here we are going to try to find out how should parents talk to their kids about puberty, because now that we've understood that it is important that parents talk to their kids about puberty, the next big question is how do we do that? So let's find out how that is easy and done.
Yes. So how is an important part of the whole conversation, because once the parents know why, and most people are convinced that they should do it, there is a bit of a reluctance because they don't know how to do it. Um, I have some few tips, few very simple tips. Make it as a part of day-to-day conversations rather than assigning a time for a formal talk. There is a lot of doubts about when, but which we will cover in the subsequent series. But we can spend some time about how. So, for instance, if a child comes with a particular situation, in a day to day, they're watching an ad or something comes up in the movie, and they ask something, have an answer for them. So that is important. And people have asked me if they should use terminologies that are commonly used or use terminologies that are in the books and medical books. For genitals, you can use body parts, like how you would describe your eyes and nose and ears. You can use, words like penis, vagina, things like that, breasts. These are normal conversations that can happen between children. Are there anything that you feel can get awkward in this whole thing, which puts parents off?
Yeah, so it's important that, say when you're giving the child a bath or when, even when a child is 3 or 4 years old, they are inquisitive about the body parts. So we should be able to tell them very clearly what is the name of the body part rather than just tell them, okay, you should not know this and all.
Mm,
Or just you can say, okay, this is your private part or private area, and nobody should be seeing it or touching it. When we talk to them about good touch and bad touch also, so slowly, and even as a
mm,
child is growing, say they are 7 or 8, say for a girl is growing, she's developing her breast bud is developing, or a little later also. So, and you're also educating them about wearing the appropriate undergarment. So involve them in that, like even to go out to say you mothers usually just go buy some undergarments for their child, but because they think, okay, maybe the girl will be more inquisitive if I take her, but take your child for that shopping also, so they will
mm.
have a choice and they will actually get something which is comfortable for them also.
Yeah. And one other thing I also had in mind was, say, for instance, if the child sits you down and say, dad or mom, I want to know about this because so and so said this, because they used to hear about lots of things. And I think it is safe from an age of 8 or 9 to talk about them developing into an adult and saying, you are becoming ready to be an adult, and when you become a big boy or a girl, a man or a woman, you will have your own children. So this is the body preparing for that. You can use very simple terminologies like that, and then that kind of in my view, settles their curiosity for now, at least at that point, and they may then want to know about it in a very structured way. And one of the things parents worry about is, will these conversations tickle their imagination and trigger more search in the wrong direction? It may, to a certain extent, because they might get more curious, but our job is to then gently guide them into good resources. There are several books, there are books with pictures, so the how can be very systematically done. And I think parents should develop that confidence to say, I can, communicate with my child on this. We may not always get it right. The how varies because children's level of intelligence and their ability to grasp information also changes. We need to modify our conversations accordingly. But there are so many tools, and if you're really stuck, particularly there are issues around precocious puberty, and sometimes I have also had situations where children have exhibited hypersexual behavior. They may, particularly some children may have some autistic traits. They may be stimulating themselves
Even
excessively
something like
to calm
masturbation, right?
themselves. Exactly.
They have
So,
been
so
finding ways
those
to do.
things don't have to be made a big issue. One, because sometimes parents may be embarrassed that their child is touching themselves in public, things like that. But again, don't be embarrassed. Don't worry about it. If it gets a bit too excessive, then there are professional help available. But keep it simple, and I would say simple is good. Get down to the child's level. Use terms that are commonly used in textbooks, in school textbooks or in medical textbooks, and keep it simple. I'd say keep it very simple. Make it as a part of day-to-day conversations and link it to day-to-day situations. Yeah, I think these are some of the common tips, we would say. I think. What do you think?
Very true. Thank you. Thank you so much. So the why is understood. And when we talk about how to talk to kids about puberty, so keep it simple. uh, be sensitive. Don't judge your child. Don't
Mm,
lose your temper. Don't get angry that they are asking all these things. It is always possible to, in a very simple language and in a very simple way, convey to the child about the different body parts, how you are going to become bigger, older, and how things are going to change. And I think addressing these concerns and talking to them in a very simple way can go a really long way, whereby the
mm,
child also develops a lot of confidence in their parent, and they are also very free that they can come and converse, because ultimately
mm.
the communications channels are always open, even though the child, when a child is a teenager, may not come and tell you everything, but at least child feels little bit of safety and security that they will not be
Absolutely. Yeah.
reprimanded or so. Thank you so
Yeah.
much, and we will be joining soon for another part. Thank you.